Thank you, chairs, and thank you, NHRC, for providing me this platform to present our work. Namaste and good afternoon. This is Ms. Sulata Karki from HUD International, presenting on topic digital literacy and factors associated with digital technology use among auxiliary nurse midwives in Nepal. So moving forward with introduction, as we embrace in the technology of digital health and other digital technological intervention, understanding how frontline health workers such as auxiliary nurse midwives engage with this digital technology is essential to understand and improve health service delivery. So digital health technology such as e-health, m-health, telemedicine enhance the healthcare service delivery in low resource setting like ours. It plays a vital role for integration of health care system in Nepal. It also helps to bridge the gap by extending service to the remote settings where there is a shortage of health human resources. So this low digital literacy hinders the effective use of digital technology or adoption of digital technology. So this study aims to assess the digital literacy and factor associated with digital technology use among frontline health workers in primary healthcare facility of Nepal. So it was a cross-sectional online survey conducted in primary healthcare facility in Nepal among auxiliary nurse midwives, and the calculated sample size was 172. We used the self-administered survey between July to December 2023 and adopted a validated tool, technology acceptance model, and unified theory of acceptance and use of technology model, where this tool include a number of several domains under which there are several multiple statements. For example, perception on usefulness of digital technology, perception on ease of use towards digital technology, attitude towards digital technology, social influence, facilitating conditions to use digital technology, and anxiety. This tool includes 7-point Likert scale responses. So these are the dependent and independent variables. So I would just like to highlight the dependent variables, that is frequency, skills, and confidence in using digital technology under the several components or indicators like computer or laptops, Microsoft applications, smartphone, tablet or iPad, email, internet, and social media, which were assessed using 5-point Likert scale. So data was analyzed using descriptive statistics and multiple regression, linear regression, to observe the association between dependent and independent variables using our program. Coming towards the results, this bar diagram shows the socio-demographic characteristics of participants. Most of the participants were under 35 years of age and holding bachelor's level educations, and were most of them were married, and around 50% of participants were from Bagmati province and were working in a health post. So this table shows the calculation of total score and composite and mean score of each of the dependent and independent variables. Here I just want to highlight the score of dependent variable, that is frequency, skills, and confidence, where the total score was 35 and the mean score of frequency was around 25, that is around 73%. For skill it was 25, around 71%, and for confidence it was slightly higher, it was around 74%. Now this table shows the factor associated with frequency of using digital technology. Here I just want to highlight the key findings that is age, education, marital status, attitude, social influence, facilitating conditions, and anxiety were significantly associated with frequency of using digital technology. For example, age, participants with age 35 years and above were less likely to use digital technology, while participants with higher degrees such as bachelor's and above and those who were single or unmarried were more likely to use technology. Similarly, for attitude and anxiety, it shows the negative linkage with frequency of use, while social influence and facilitating condition shows the positive association with the frequency of digital technology use. Now, this table shows the factor associated with skill in using digital technology. Here, age, anxiety, and frequency of use was significantly associated with skill in using digital technology. Here, anxiety is like earlier in terms of frequency of use, with those having higher anxiety were less tend or less likely to use digital technology, or they have less skills to use digital technology. Similarly, those who tend to use more digital technology had like increased skill in using technologies. Now this is, I think this is the last slide. This shows the factor associated with confidence in using the digital technology. Here several factors shows the significant association with confidence. These are age, perceived usefulness, attitude, social influence, facilitating condition, anxiety, frequency of use, and skill. And the factors are more or less similar with skills and frequency of use. Finally, to conclude, there are several personal, social, and environmental factors that shaped A&M's use of digital technology. So this highlight that consistent use and skill development are essential for building their confidence and enhancing their performance. So this suggests that empowering health providers or like frontline health workers through tailored interventions, such as our study has identified age, education, marital status, shows the significant association. So focusing on these factors, we can develop the tailored interventions and training programs to help them leverage the technology more effectively that can help driving better health outcomes in low resource setting like ours. So finally, to end, I said like digital technologies and tools are not just a luxury. It is essential to promote digital technology, especially for the frontline health workers where there is a shortage of health workforce in primary healthcare settings. And this help leveraging the system and use of technology in this digital era. Thank you so much.